have you heard of the drug Midazolam? Midazolam was and is used as part of what is called end-of-life care. Precisely how and why it was prescribed during the past 3 years has preoccupied the minds of many people. Those whose loved ones were given Midazolam, in care homes especially, want to know more about how and why the decision was taken to prescribe that drug.
I was then told they were going to introduce end-of-life medication, which would be Midazolam and, if needed, and morphine, and I was shocked. Subsequently from that, I found out that Midazolam isn't a particularly nice drug, and some practitioners refer it to being waterboarded because it floods the lungs. And I don't know if it's been removed, but I believe there's motions afoot to look in at the use of Midazolam and morphine in end-of-life care.
We consulted with GPs over the phone, and 9 times out of 10, regardless of what the resident's symptoms were, they were prescribed just-in-case medication. Okay. We really struggled. I think it was months and months before we got a GP into our home.
You mentioned that often all that would happen was that just-in-case medication would be prescribed. If it was something more mild, were you able to get things like antibiotics and milder treatments?
We prescribed antibiotics, but 9 times out of 10, if a resident didn't get better from that, it was just in case was prescribed.
Okay, thank you.
Can I just pause you there while I bring in the doctor? You know, because I think it's appropriate that we bring in Dr. Malcolm Kendrick, GP. You're listening to this, Dr. Kendrick. Can I just segue, bring in your contribution at this point? How were elderly people in care homes being treated? You know, were GPs readily admitted during the time of lockdown to see patients face to face?
Well, a lot of doctors didn't go in to see people face to face. I worked in a number of care homes and also in working with the elderly, and so approximately, I think 36 of people that I was involved in did die of what was probably COVID. But yes, quite often, and during this situation, a lot of people were prescribed things without necessarily being seen by the GP. So that would be the case, yeah.
So it wasn't necessarily the case that, as one might expect in the case of the care of a loved one, that a GP was intrinsic to that process, that treatment was being administered by people who weren't general practitioners.
Well, it would normally. Well, saying they didn't go in, they would have been communicated with, sometimes over Zoom calls or whatever. So there would have been a decision made by a doctor somewhere that the patient was approaching end of life, and that therefore, if they could put them onto what are called the end of life medications, that would be a medical decision. Sorry,
it must surely take a great deal of wisdom, to be looking at an elderly patient who, let's say, has a respiratory ailment that's making it hard for that person to breathe. How would a decision be made about whether or not to treat that person and keep them alive, or, on the contrary, to prescribe a combination of drugs, including Midazolam, which suppress breathing?
Yeah, well, these are difficult decisions. They are very tricky things, obviously, because you are at a stage where you're saying to relatives that we believe that, your loved one is actually getting worse, is not going to recover, and therefore we need to try and make them as comfortable as possible.
I've ascertained that the sedative that she was given is one called Midazolam.
That's correct.
And we've heard about Midazolam from other witnesses, and I think it is associated with end-of-life care.
She was also given 2 other drugs that were part of an end-of-life protocol.
And what's your reaction to learning that?
I'm very angry and very upset about it. From the medical notes that I've read, the GP had called on the 3rd, the day before she died, to check on her condition, and the care home had actually said that she had improved slightly from the day before and that her observations had got better. The GP had actually said that whilst they had got better, they were still still a bit poor, and would she perhaps benefit from going to hospital. The care home had stated that us as a family didn't want her to go to hospital and that my grandmother didn't want to go to hospital. But none of this is anything that we had said. We never once said that we didn't want to go to hospital. Sorry, I'd always said the exact opposite. And if my grandmother had said that she didn't want to go to hospital, then I, as power of attorney, could have overruled that. Also, it said at this point that there was a DNR in place in the medical notes, which again, I've only had sight of recently, so I wouldn't have known that at the time. So the care home staff said no, the family wanted to remain at the care home, and the doctor said, fair enough, we'll leave things as they are. We will give you these drugs, and it was the Midazolam and the 2 other drugs, which are part of an end-of-life protocol, just in case, was the terminology used in the medical notes. But there wasn't specific instructions to administer them at that point. So I don't know at what point the care home chose to administer those drugs, but it must have been at some point between the afternoon of the 3rd and the early hours of the 4th.
Yeah. And just to be clear, you weren't consulted in any way about that?
No.
The other side of it was what was happening with end-of-life medication, whereby people who we had the protocols that were binary in terms of what could happen if somebody deteriorated. And if they weren't going to be actively treated and put on ventilators, then they were to be given end-of-life medication. Now, it doesn't mean that everybody in a care home with COVID ended up on end-of-life medication. And there would have been some for whom that would have been appropriate because they were going to die. But it seems that there is a bigger middle portion here than I had appreciated at first, because there are so many people who've been telling stories about their loved ones who, under other circumstances, would have been treated very differently, and who, for lack of visitors, which was a big deal, did not have the support and care they normally would have had, and were being given these drugs, which are very powerful and dangerous, and which palliative care experts were calling out in May 2020, because these protocols were very explicit about how you accelerated the drug, but said nothing about winding it down. And these drugs suppress the respiratory drive. So where they have a great usage in end-of-life care when you've got cancer, it's a different story when you've got an acute respiratory infection, and the drive to breathe is incredibly important in terms of...
It was almost like a random decision to keep him quiet, keep him in isolation, in a room, in a comatose state.
Liver medication, particularly things like midazolam and morphine. Do you have any precautions put in place to make sure we have enough of those medications to be delivered?
Yes, we've got a big project to make sure that those sorts of medications, as well as the ITU medications that I spoke about earlier, that the supply chains, global supply chains for those medicines are clear.